Good day, everyone. So the topic that we're going to discuss today is about sexual health and hygiene. So sexual health is about understanding and respecting your body, your feelings, and any relationship you may have. It means making smart, informed choices about your sexual experiences, keeping them safe, positive, and avoiding risk sexually transmitted infections or unintended pregnancies. On the other hand, sexual hygiene involves keeping your body, especially your private areas, clean and healthy. This includes washing regularly, wearing clean clothes, and understanding the importance of safe practices if you become sexually active. It also means paying attention to your health by visiting a doctor when necessary to prevent infections or other health issues. So health means feeling good physically, mentally, and socially. So if we exercise regularly, we eat well, we manage our stress, and has a good social relationship, we're considered as a healthy person. Because health is not just about not being sick, it's about how we manage ourselves and how we interact to our peers or to our surroundings. Hygiene. So hygiene is about staying clean to stay healthy, which includes washing our hands, face, and body regularly with soap and water to prevent illness. So if we wash our hands before eating, taking shower daily, and brushing our teeth every morning and night, we are practicing a good hygiene. Now, the sexual health means being healthy in your physical, emotional, mental, and social aspect related to sex. It's about having respectful, safe, and enjoyable sexual experiences without pressure, discriminations, or violence. So, an example is that if a couple who communicates openly about consent, uses protections during sex, and respect each other's boundaries is practicing a good sexual health. So now let's proceed to reproductive health. Reproductive health means being in a good state of well-being when it comes to your reproductive system, including your physical, mental, and social health, not just avoiding disease. Now let's proceed to puberty. So during puberty, your body goes through a lot of changes, which are completely normal as you grow into an adult. So there are some changes on your body during puberty, such as oily hair, sweat and odor, body hair, and dental hygiene. So let's proceed to oily hair. As your hormones change, you might notice your hair gets oily faster. For an example, if you wash your hair in the morning, it might feel greasy by evening, just like using too much hair gel. Yeah, so that's one of the signs of puberty. Next is sweat and body odor. You start sweating more and it might smell stronger than before. That's why using deodorant becomes important after doing something or during a hot day. So it is very crucial, very important during puberty that we use deodorant if we notice that our body produces some bad odor. So let's proceed to body hair. Hair will start growing in new places like under your arms, on your legs, or on your faces. If you're a boy, you get a mustache, or you get a beard. Whether you want to shave it or not, it's a personal choice. For an example, some girls choose to shave their legs, while others don't, and both choices are okay. Now let's proceed to the fourth one, the dental hygiene. So taking care of your teeth is very important, especially as you get older. Brushing your teeth at least twice a day and flossing can help prevent cavities and gum disease. For an example, if you brush your teeth every morning and night and see the dentist regularly, you are more likely to have a healthy smile.
Puberty causes many changes in an adolescent's body, both male and female. So there's an healthcare check for female and male. First, for female, you need to do the self-breast examination. The best time to do the self-breast examination is 1 week after your menstruation, because this time your breast is not tender and swollen. In doing the self-breast examination, you need to use your 3 fingers. If you're going to examine the right breast, you need to use the left hands and vice versa. Doing self-breast examination enables us to know what are the changes in our breasts and if there's something wrong in our breast. We should be aware of the abnormal fluids coming out from our body. We are advisable to consult a doctor or a health professional if there are abnormal fluids coming out from our genitalia. It is abnormal fluids if it is color yellow or color green. Washing our genitalia, we should wash the external genitalia, but we should not include the internal genitalia. And in washing it, we need to wash it from vagina to anus, not from anus to vagina, because if you're going to wash it from anus to vagina, this would allow germs to enter to your internal genitalia that can cause infections. In washing our external genitalia, you need to use soap and water, especially during our menstruation. It is really advisable to wash our external genitalia. And during our menstruation, we need to use cotton pad or a piece of cloth. The best example of cotton pad is the sanitary napkin or tampons. This piece of cloth or cotton pads will absorb your menstrual blood, but after using it, you need to dispose it properly. And as for cloth, you need to wash it before reusing. In the healthcare for male, they should wash their penis or their external genitalia using a soap and water as they wash the rest of their body. And for those male who are circumcised or para sa mga lalaking hindi patuli, they need to pull back the foreskin and wash it gently to remove the dirt underneath in it. And they should be aware of the abnormal fluids coming out from their body. They would know that it is an abnormal fluid if the fluid coming out from their body is color yellow, color green, a bloody one, or a cheesy one. They are advisable to consult a doctor or a health professional if this would happen.